to the Transportation Committee meeting of Wednesday, February 14th. Happy Valentine's Day, everybody. And happy Ash Wednesday for those of us with dirty foreheads. I'm joined by my colleague, Nuri Martinez. I believe Mr. Koretz is coming to join his paperwork shortly. I'm going to need some guidance and assistance from the clerk on how to use this new system. But in the meantime, I am going to start with public comment. We have, I'm going to call it Mr. Previn for what I believe is a number of items. 2 minutes for all of his items, and then 1 minute for general public comment.
Okay, thank you. It's Eric Previn from Studio City, CD2. And I came down today because as I was leaving, I was glancing at the agenda, and I noticed that case file 180110, which is item 8 on your agenda today, is for a preferential parking district in the hills of Studio City, just above the vibrant community on the boulevard in Ventura Boulevard in Studio City. So we heard about this in the neighborhood council, and it was a very tense vote, 7-8, and then it finally was approved to go past that level. And then apparently it went to the commissioners, transportation commissioners, and the question remains how many spaces are going to be preferentialized. It has not been stated clearly. And we have a real problem along the boulevard in that employees and stakeholders who use this wonderful boulevard are going to suddenly be cited, possibly. Now, I realize that you didn't cook this one up yourself, sir, but what I've been asking for is a kind of a comprehensive city strategy about how, if we preferentialize neighborhoods all over the place, and certainly this has been done widely in lots of areas, and I've noticed it, some different kinds of restrictions, but this preferential parking district is the one where you buy a $35 plaque and then you retain the right to park there, or someone else with a placard, you could give it to your friend. One very specific legal question, I'm a bit of a legal fuss budget, is if I work at the sushi restaurant on Ventura Boulevard regularly and I would like to purchase a $35 placard to park on Reclaw Drive where I live, is that okay? I think it should be, because why will we discriminate against people who are working for a living and trying desperately to get by and find a place to park without pernicious fees, whereas somebody who happens to own the residence that's worth $1 million has multiple spaces on the street, when we all know that they are required by zoning to provide parking on their property and so on and so forth. So, whereas I know neighbors love this and become ecstatic at the thought of giving a private placard to retain part of the public roadway, I think it speaks to a really big issue, which is where are we going with this, and how are we going to avoid a situation where people who visit and shop and participate in work in our area are going to be pushed out of all the available parking. And I just think that it's really bad. And the worst part is that I reached out to Councilmember Krikorian's office in repetition, and I'm a very specific repeater of what I wanted. I wanted help so that we could notify the employees, so that we could notify the other stakeholders, and because the neighborhood council had agreed, we couldn't get that money, so what can we do? So he should help. Areen Ibranesian is a great man. He controls the budget over there. Matt Hale was his legislative deputy. I repeatedly inquired of these groups to help us notify the thousands of residents who are going to be impacted.
Thank you very much.
Would you like a general public comment? Or?
You used that minute up.
Oh, thank you.
Thanks. All right, colleagues, I'm going to recommend items 1 through 6 and 8 for consent. Any objections?
No objections.
No objections, so that is the order. And then item number 7, CD10 has asked that this be continued 6 months?
Indefinitely.
Is there a way to, we'll continue at 6 months.
Okay.
I don't know, that would be a receive and file. Okay, that brings us to, let me start with item 10.
Item 10 is a Bond and Harris Dawson motion relative to directing LADOT to report on the recommended replacement pedestrian safety device for locations where DOT has planned to install rapid rectangular flashing beacons and related matters.
Thank you. So let me just tee this up for you. Colleagues, I submitted this motion in an attempt to get the City of Los Angeles to exercise some leadership in cutting some red tape that is being put in place by other levels of government. We're seeing on any number of issues that local cities have to lead, and this is a case where I think we have to take some leadership. There are, I believe, dozens of crosswalks in the City of Los Angeles where we had planned to install flashing beacons, and the federal government recently, due to a patent dispute, decertified the type of device that we were going to use, which impacts not just the dozens here in Los Angeles, but potentially hundreds or thousands around the country of safety devices. And so what we've asked in this motion is for DOT to come up with an alternative to install as quickly as possible so that we can be protecting pedestrian safety at these crosswalks and intersections and help the Department of Transportation pursue its mandate of keeping people safe in the city.
Well, thank you for that. Good afternoon. My name is Carlos Rios, and I'm the Division Manager for the Complete Streets Division. And in response to the Council action, I'm here to report that DOT has identified 2 possible replacement options to the rapid rectangular flashing beacons, RRBs, if you will. And they're both in full compliance with state standards and meet the overall objectives of what the original RRBs were intended to have. One of the options that that is on the table is to install the sign with the border, with lights around the border that are going to flash, and also to replace, the other option is to replace the rapid rectangular portion with circular beacons, if you will. So at this time, I'm here to report that we do have 2 options that we're looking into. We will be installing the perimeter lighted ones at the intersection of Pacific and Sunset this coming weekend. And we also have a procurement and order. We've ordered some the circular flashing beacons as a replacement as well. So we're going to be looking at both those options and evaluating them for compliance with regards to how the motorists yield to pedestrians as they're approaching an intersection that has this treatment. So with that, that's my report is that we are looking at 2 options that are both accepted and both have been tested across the country, and they have sure to meet the overall objectives of the RRFBs.
Excellent. Thank you. Any questions, colleagues?
Yeah, so how long do we have to redo our beacons? Do we have a time frame? Or are they giving us a certain time frame by which we have to redo existing beacons?
Not necessarily. What the FHWA has come down with is essentially rescinded the interim approval that they had given us for the rapid rectangular flashing beacons. Now it's up to each agency, LADOT included, to come up with a replacement as quickly as possible. There is no set time frame. It's our due diligence to expedite this process and find a suitable replacement and start putting them in the ground.
But we don't have to remove them. We just have to alter them.
The direction was that anything that was in the ground by December 21st, 2017 are in full compliance and will stay. If they happen to be demolished or broken or vandalized in the future, then we would have to replace them with an alternative. But anything that was installed prior to December 21st remains
Gets to
intact.
stay. So how many did we have planned for installation before the federal decision was issued?
Several dozen. I don't have the exact number right now. I know that we had some in our program under the Vision Zero program. We had some in our program that were funded through HSIP grants. So there's several dozen that we have already.
If there are any in my district, can you let me know?
Yes,
if there
definitely.
were any planned?
Yes, definitely.
Okay, thank you.
Mr. Kretz, any questions? All right, so seeing no objection, we will approve this item, and DOT will be reporting back to us in 30 days on part of the motion and 90 days on the other. Thank you very much. I want to thank DOT for being so cooperative and willing to put our mandate ahead of some of the top-down nonsense from D.C. That brings us to item number 9.
Item number 9 is the DOT report in response to a Krikorian Rue Blumenfield motion relative to developing a specific implementation strategy for Vision Zero policy.
And let me start with the 3 public comment cards. Daisy Villapuerte, if that's spelled correctly, Lindsay Nolan, and The first person I'm going to ask to speak is Wayne. I don't see him here, so he's forfeited his time. So we'll go to Daisy and Lindsay.
So my name is Daisy Villapuerte, and I am the Advocacy and Engagement Manager for Los Angeles Walks. We are a pedestrian advocates and convene the LA Vision Zero Alliance. We don't disagree with the motion as written, but disagree with the spirit of the motion, which calls into question the city's Vision Zero methodology and a core principle of Vision Zero, the prioritization of vulnerable road users like pedestrians and bicyclists, vulnerable users who may not have the financial, age, or ability privileges to use and access motorized mobility. This motion calls for LADOT's increased data validation process, and we are confident that DOT can handle that. However, the spirit of this motion attempts to bring up potentially prioritizing roadway improvements and shifting the conversation away, yet again, from vulnerable users. As clarified in DOT's response presentation, the high injury network highlights
Finish the sentence.
highlights a grave need that has been left out of engineering first approaches, social equity.
Thank you. Please go ahead, Lindsay.
Mr. Bond, could I interrupt for just one moment?
Sure.
Just to note that Mr. Spindler has arrived and, of course, making distracting goat noises, and I would encourage us to limit that ability or have him removed.
The next disruptive sound or gesture from Mr. Spindler will lead to his removal. Thank you. Please go. Okay, and that was it. It didn't take you long, Mr. Spindler. Please leave.
I can't make a middle finger.
Please leave the room.
I can't make a middle finger like this. I can't do that. Are you fucking serious, dude? Are you serious, bro? You can't do that? Are you fucking serious, dude? You are fucking retarded, man. You are fucking retarded. You know? It's going to be so nice when you put your ass in federal court for this shit, dude. It's going to be so nice. It's going to be 15 you motherfuckers. You know, Nuri, she's too smart for that.
For the record, Mr. Spindler is being evicted for a verbal outburst right after Mr. Koretz notified that he had already violated his first warning. So, Ms. Nolan.
All right. Hello, my name is Lindsay Nolan, and I'm here on behalf of LA County Bicycle Coalition, where I am Policy and Outreach Coordinator. LACBC works to make all communities in LA safe and healthy to ride a bike. While we don't disagree with the importance of a robust, data-driven methodology to inform Vision Zero projects, implementation, and DOT's work plan, we are concerned that the motion reorients the conversation away from social equity concerns. We should prioritize projects that benefit the most vulnerable users and communities first. The methodology already does this by prioritizing injuries and deaths of children and older adults, as well as historically disinvested communities experiencing disproportionate racial and health disparities. Nearly half of the HIN falls in vulnerable communities, including low-income communities and communities of color. These are often the same communities where folks walk, bike, and transit to get around. Vision Zero isn't just about safety, it's about justice. We support DOT's methodology and urge members of TCOM to continue supporting this methodology. Thank you.
Thank you very much. Thank you both. If the department could come up, it's going to present on it. Let me first say, as Mr. Gale gets his presentation together, from my perspective, this is a motion that has been mischaracterized widely from various different perspectives. There are folks who have historically or recently opposed Vision Zero who, from my point of view, don't quite understand what Vision Zero is, who have heralded this motion as a saving gesture that will stop Vision Zero. And then there are those who've long advocated for Vision Zero who fear that this is somehow an attempt to undo Vision Zero. I'm less concerned with the reading between the lines of where some of the folks who have advocated for the motion want to go than I am with what the motion actually calls for and specifies. And as someone who is trying very hard to advocate for Vision Zero and its implementation in Los Angeles, I view this motion as an opportunity for the department to better explain Vision Zero, better explain what projects are selected and what benefit will be made from them. I think it gives us a level of transparency that is helpful in helping us hit the reset button on the Vision Zero debate. Particularly as I compare the public dialogue over Vision Zero in other cities, in New York City, I think we have had a difficult time getting the message out about what Vision Zero is, what the multiple aspects of it are, and what the ultimate goal is to save lives. So if this motion helps, if the reports asked for in this motion help explain things better to the general public and to policymakers and helps us get to better implementation, then I think ultimately that's going to be a win for all of us. So Mr. Gale and Mr. Freemo.
Great. Thank you, Mr. Chair and honorable members of City Council. My name is Nat Gale, and I'm the manager of the Vision Zero division within LADOT's Bureau of Capital Projects. I'm joined by Tim Freemo, our lead safety engineer. We do appreciate the opportunity to call attention in Councilmember Krikorian and Ruth's motion to the importance of sound and fact-based approach to street design. Vision Zero is fundamentally a data-driven process. It relies on full data transparency and well-informed and documented decision-making to achieve those safer outcomes for our streets. So we've got about a 15-minute presentation, and then we're happy to answer any questions. We'll be covering how our data underlying our Vision Zero efforts is comprehensive, public, informs where we do our work, and guides how we design. I'll walk you through the data assembly process and how we've gone further than ever before to make this data available to the public. I'll go over a draft process on how our engineers and planners use this data to guide how and where we engage and implement safety solutions. And I'll end with an example of a new and innovative approach to the use of this large data set that we've assembled, which is leading to process improvements at LADOT. So first, a quick snapshot of the data process and assembly. A brief introduction to what we mean when we say data. Collision data is the foundation of the work that we do in Vision Zero. The statewide integrated traffic record system, also known as SWITRS, is a statewide database we connect to in order to pull collision information on city streets. Data standards are set at the state level with the California Highway Patrol, who manages the SWITRS system. Even though it is our local LAPD that collect this data, it is through this CHP process, the SWITRS process, that the data is digitized, formatted, cleaned, and released to the public. SWITRS answers the who, what, where, when, and how of collisions. This is a snapshot of the process when LAPD fills out a collision form, known as Form 555, and then sends it to the California Highway Patrol. They prepare SWITRS tables to process, organize, and digitize that data. When we first started Vision Zero in 2015, there was a 2-year process from when LAPD filled out the form to then when that information was publicly released to transportation departments. Since then, that process has been reduced to about 7 to 9 months. LADOT receives that data, cleans it, and accounts for some basic errors, no XY coordinates, so making sure we map it, potentials for contradicting information, and then that is passed to our engineers and planners to use that collision information to inform safety engineering and design. So, how did we use this data to embark upon Vision Zero initiative? We're a large city. As we're all well aware, we need to decide where we should target our resources to be most effective in reaching this goal. So we began with a basic overlay of 5 years of that collision information on our city streets. And we found that a small percentage of streets accounted for a large majority of the crashes that result in death and serious injuries. This is what we call the high injury network. And this was based on research from other cities, New York, San Francisco, Seattle, the state of Florida, industry best practices showing that we needed a multi-year analysis to identify safety trends, and that we would perform a network analysis to connect, to understand the network of streets that account for the large share of deaths and serious injuries. So this high injury network represents the 6% of our streets that account for 2/3 of the deaths and serious injuries for people walking and biking. And we focus on people walking and biking to develop this network because they're overrepresented in the collision data. They make up 15% of collisions, but over half of all the deaths. And so as we are progressing towards reducing and eliminating deaths, if we can make those locations safe where we see a high volume of deaths of people walking and biking, it will lead to safer outcomes for all. We also overlaid.
I just want to interrupt to ask a question about the high injury network.
Sure.
'Cause I think this is an opportunity to sort of explain something that has been a misunderstanding both at this level, the council level, and the public level.
Absolutely.
Is the high injury network based solely on just the cold, hard SWITR numbers, or does the high injury network is it determined by weighted factors that include more points for cyclists and pedestrians?
It is determined by the cold hard facts of collision data.
So I just want to repeat that because this has been a misunderstanding even at the council level and certainly at the public level. Is it the high injury network is determined solely by the SWITR data?
That is correct.
Thank you.
Right, what is it in council?
Yes.
Yes.
And yes, absolutely.
Yeah.
Yeah.
Yeah. Great. High injury network, collision information only. We also then overlaid this high injury network with our city's Community Health and Equity Index, which combines demographics, socioeconomic, health conditions, land use, transportation, et cetera, to understand communities that have more negative health outcomes. And we found that half of this high injury network falls within our existing underserved communities, indicating an equity issue to consider as we approach our work. But we didn't stop with just collision information because we also wanted to know how the environment affects collisions that result in death and serious injury. So we added as much infrastructure and environmental information that we could get our hands on. This includes the presence of a traffic signal, a countdown signal, crosswalk markings, bus stops, street trees, etc. We assembled a large collision and infrastructure database, and then we published it. So this database is available online on the GeoHub, which is the city's geospatial database, for anyone to download and understand how we assembled it, what we're using, what our underlying information is. And this is to demonstrate our commitment to data transparency and making sure everything we do is public and available. So in summary, the high injury network was developed using industry best practices. It's 5 years of collision data. That's it. 5 years of collision data to underpin the high injury network. It was a network analysis that looked at our overrepresented population. We developed an infrastructure asset database to combine with that high injury network, and then we regularly publish and update the data. So we began with an overlay of 5 years of information on the City of LA street network, highlighting that high injury network. Even though it only represents 6% of our streets, 6% of 7,500 miles of streets is still 460 miles. So how do we develop an annual work plan, something that's a little more bite-sized, something that we can prioritize our efforts in our Vision Zero team internal to LADOT? So first, we developed potential location priorities. So in February and March of 2016, we met with Vision Zero public stakeholders, including members from the Vision Zero Alliance, AARP, members of different city council offices, our Vision Zero task force, different city departments, to solicit input on the factors we should consider to develop our year one work plan, what was going into our first Vision Zero action plan. And we asked whether we should prioritize areas with highest crash severity, dangerous behavior, social equity, geographic equality, party vulnerability, and low-cost, low-complexity solutions. So after distributing a survey to over 62 people in person and over 500 online, we arrived at these following 3 priorities. Crash severity, so whether there's a severe or fatal crash at a location. Party vulnerability, that is seniors and children who are statistically more vulnerable to death when a crash happens. And a social equity indicator to highlight that we do have an equity imbalance in where the high injury network falls in the city of Los Angeles. So what does that look like and how we applied it across the high injury network, we developed what we called an intersection score. So this is taking a fatality at a particular intersection, multiplying it by 1.5 plus a severe injury, adding a 1 or a 0 if a child or senior was present, a 1 if that intersection was in a social equity community. This is what that distribution looks like in terms of the majority of intersections on the high injury network scored 3 or under. So where we were really looking to understand where we should focus our efforts in that first year was where there were high scoring intersections greater than 3. That's what developed our priority corridor network, and this is what was published in the 2017 Vision Zero Action Plan. So I do want to note the priority corridors are different than the high injury network. The high injury network is that first collision analysis based on 5 years of data. The priority corridors are weighted differently so that we could have a work plan in 2017 to meet the goals called out in the Vision Zero initiative, 20% reduction in deaths.
So let me try to state this very clearly and underscore it. The high injury network, the list of the worst streets in the city, is developed from cold, hard collision data, regardless of cause or victim. That is hundreds of miles of roads, and to determine which ones to focus on first, DOT sought to consider where people are most likely to die based on their vulnerability. So someone walking is far more vulnerable than someone driving a Hummer. And so that's where that perception of some weighting comes in, because the weighting is choosing where are folks most likely to die, and so that's the project we should, of all the projects we have to do, the one we should put at the top of the list.
Right.
Okay.
Right. We are a small team inside LADOT, and we needed some way to have our work plan. We are not. We do not represent all of LADOT. This was just for our team, our efforts to go and proactively begin to install safety improvements to save lives. So how do we do that? Right. That's next. So after priority locations are identified, our engineers and planners move into conceptual design. So there you see Tim Vermeau giving a training in 2017 after we published the Vision Zero Action Plan to the team of engineers and planners who are going to go throughout these priority corridors and recommend safety improvements to save lives, to lead to safer outcomes on our streets. So Tim developed a toolbox of safety countermeasures. We then did a detailed mapping of the collision hotspots, which is what you see on the right of the screen, and the surrounding assets and land use. Are there churches or schools or parks? What's the mobility plan tell us? What are the other planning contexts to make sure that we have both a detailed engineering analysis and a planning effort to design safety improvements? So what does the real nitty-gritty of that look like? This is an example of what a collision diagram looks like that our engineers use to identify correctable collision patterns. And I do appreciate Councilman Krikorian's focus on making sure that our effort goes to address the issues that we see on our streets. So we do this real deep dive into every single collision that happens and what are the trends and patterns of collisions that can lead to a solution that addresses that collision. So for example, if we see 2 fatal left turn vehicle-to-vehicle collisions within a signalized intersection, we know that means we should install protected left turns. That's going to address that problem that's identified at that particular intersection. And so every street has a detailed deep dive of collision information to then lead to design solutions, what we call safety countermeasures, that will have a collision reduction factor that we know, based on data, leads to safer outcomes on our streets. What does that look like then on a corridor? So this is looking at the different safety improvements that are recommended by a particular engineering team. For all the different safety countermeasures, whether it's new signal timing, new striping, new intersection improvements, new safer crossing points. This is then the plan that is developed. But we also want to take it and engage with members of the public, make sure that we ground truth our solutions and have project-based engagement and solicit community feedback. That involves translating the engineering work into plain English. We actually have a little book called Planning in Plain English that we pass around when we're going out and talking to members of the public, because we need to make sure our information is accessible, we're being responsive and transparent, and have a dialogue that informs the work that we do. So in summary, we did do a location prioritization effort, and we developed a methodology based on a public vetting process in 2016. The priority corridors are a subset of the high injury network, so about 90 miles of priority corridors versus 460 miles of the high injury network. And then we do look at our safety improvements in phases. So we design and install in different phases. Phase 1 is striping and paint, things that we can do relatively quickly on a small budget. Phase 2 is signal improvements that involve a little more capital construction and are a little more expensive. And then Phase 3 is when we can ultimately build out improvements in concrete, which has the most sustainable safety benefit. So last, I just want to give a little preview of how we're using this large database to actually change the way we do business at LADOT, and an example of what we call a big data application. Big data is this assembly of this huge transportation database that combines both collision information with what are assets on our city streets. So this next slide, I'm sure, is going to excite everyone in terms of the engineering approach to warranting a traffic signal. This is really what keeps us so exciting.
More and more excited.
So this is what a typical transportation engineer will go through to warrant a new traffic signal. So when somebody picks up the phone and calls our district offices and says, I want a traffic signal at this location, these are the steps required to go through to check all the different manuals and codes and standards to make sure that that location qualifies for a traffic signal.
Not enough for it to be Councilwoman Martinez says so?
Thank you.
No comment.
I found that to be a good rule of thumb.
So historically, we do rely on requests, right? We do rely on Council Member Martinez and other members of Councilmember Martinez's district who call us and ask for improvements. And so that is how our work plan is developed. We get a request, we go out and we investigate it. If it meets the criteria, we put it in a work plan. If it doesn't, we respond to, well, we probably wouldn't respond to Councilmember Martinez. We'd find a way if it didn't qualify on first take. But it was a more reactive approach. We relied on members of individual communities to identify those problems for us, to identify those issues for us. What we're able to do now with this big data set is develop a script, develop a computer code that can actually automatically scroll through the collision database and identify locations that have the safety criteria for a traffic signal and the lack of a traffic signal, because we have that asset information, so that we can proactively identify locations that qualify for a protected left turn, for example, without having to rely on someone picking up the phone and call us. So we can be more precise in targeting our improvements, we can be more efficient in the use of our time and the application of our countermeasures. And this programmatic approach is another key tenet of Vision Zero, so that it's not just the priority corridors that we're going and doing the deep dive and identifying safety improvements. We're able to take a programmatic look at what locations qualify for an upgraded crossing, what locations qualify for a safer signal. And this two-pronged approach is really how we're going to get to these safer outcomes in Vision Zero. So, quick summary of that: transportation big data allows for proactive identification of safety needs. It's a much more efficient use of our LADOT engineer and design resources, and these programmatic applications of safety countermeasures are a key way in which we're going to reach Vision Zero. So, wanted to just end with a few next steps. We are going to be publishing an updated high injury network because, as I mentioned, the state California Highway Patrols has new collision information, and they're able to update that on a much more regular basis, so that will include 2012 to 2016 data. We're also working with the County Department of Public Health to identify where we're missing information in our data. So where we see that there might be an underreporting of crashes for any particular reason. And also document the cost, the economic cost, the social cost, the public health cost of fatalities and severe injuries unique to Los Angeles. We, of course, are undergoing ongoing evaluation of project effectiveness. That's both corridor projects and the programmatic approach. Are our projects actually leading to the desired effect that we expect. That's a key tenet of Vision Zero, ongoing evaluation. And then we do coordinate regularly with state transportation agencies to update how LAPD transmits its information both to the state and to us, as well as improving our safety data across the state and our education efforts with various California state transportation departments. So with that, I'll end our presentation and certainly happy to answer questions.
A couple quick ones from me. You talked about improving sort of the system of reporting with the state. Are there any potential changes to the Form 555?
Yeah. So Form 555 is a standardized form across the state of California. And so actually, City of Los Angeles, our general manager, Sleater Reynolds, co-signed a letter with other local transportation agencies, San Francisco, San Jose, Long Beach, to change Form 555 to make it easier for our police officers to document some key data that we know will be useful in understanding collision information. And so one of those things is speed. We hear from our officers all the time that every collision that results in death and serious injury has speed as a contributing factor. However, the current form only requires the officer to put one collision factor. It's a requirement to have a primary collision factor that may be distracted or alcohol involved, right? But that speed was then this other contributing factor. So we've asked the state to update the form to make it easier to just check a box as to whether they believe speed was involved in that particular collision.
Okay. Not all collisions get reported to police. Is there any way to capture like hospital data?
Yeah, so that's exactly what we're trying to do with the County Department of Public Health. Okay. So they have better access to the trauma centers because they have different protection of their data, and they're able to get in and understand how many people are checking themselves into a hospital because of a traffic crash that wasn't reported initially to the police for a variety of factors, because they didn't think it was as serious, but yet they had a broken bone, or they didn't feel comfortable calling the police. So that underreporting will also help us identify other locations to focus our efforts.
Okay. Ms. Martinez?
Yeah, so what is the most current data that is available to us? Is it about a year old, 2 years old?
I believe we have midway through 2017 up to date from the California Highway Patrol SWITR's database.
And what can we do to ensure that that the data that Vision Zero program that you're developing is actually the most accurate and up to date? Is there anything we can ensure to be able to get the most accurate data available to us?
Yeah, so one thing that LAPD is doing is they got a grant from the state to get digital handheld devices to record every traffic crash. And so that will make it so that on the old paper form.
And they're currently using that form?
They are currently testing the new digital devices. So it's not department-wide, but they have a grant from the state to implement.
So when are they going to, have they purchased all the devices, and when are they going to roll it out so that the data is available to us?
I'm not exactly sure, but I could certainly talk to my colleagues in LAPD and get that information back to you.
And how is this methodology compared to what other cities are doing across the country, like, for example, New York?
The methodology that we use to develop our high injury network is based on that of
the New York model?
New York, San Francisco. The state of Florida is actually a leader in safety data analysis as well.
Mr. Koretz?
Yeah, at least my understanding is it seems like once we've identified the most dangerous areas, we're looking at reconfiguring intersections and a number of other technical steps. The one I haven't heard talked about much, we dealt with a few years ago when we put in red light cameras. We didn't put them in the most dangerous intersections. We put them at 2 per council district. And then there were other cities that looked at the same issue and started removing the red light cameras because they found that if you change signal timing slightly, you could eliminate all the red light camera violations. And wherever you've eliminated a red light camera violation, you've probably eliminated a lot of collision opportunities. So why are we not looking at that as a really easy, really quick way to get at some of those intersections while we're doing the more difficult and more technical steps? When we could change a second here and a half second there and make it much less likely that we'll have those interactions.
So regarding the ability to use signal timing as a way to mitigate crashes involving people running red lights, it is a tool that we are looking at and using, and it has some ability to mitigate those crashes by making, for example, an all red phase longer. But there's a limit. Of course, certainly there's still going to be persons that run the light well after that period, or there are other conditions that can contribute to those crashes that it won't eradicate them. So we are currently looking at our historical data when we did have the red light cameras installed, just to see what their impact was, because there's been a lot of mixed evidence coming from other places around the country about whether they actually help or not. That's aside from all the legality issues and the issues of actually upholding the tickets in court, which is one of the reasons that the program was removed. So it's something we might look at again in the future, and more on a need basis, not a random basis. But they're both tools I think that should be under consideration. It's not just one or the other.
Yeah, I feel like we haven't looked at that as an opportunity as much as we could have. I think it really would eliminate a lot of the interactions. I mean, realistically, some people use an extra half second past the red, but you could come up with a number of seconds at each intersection whereby people really aren't running it. I mean, yes, once in a while someone will miss the light entirely, and 10 seconds into a red they'll run it, but for the most part, it's probably a quarter of a second or a half second. So if they were all red for a second, you'd eliminate virtually all of that. And where that's happening on a regular basis, it seems like it would be a really easy, if nothing else, an interim step. Because if we have 100 bad intersections, 2 years from now, we're not going to have done all 100 bad intersections. But we could relatively easily have done the signal timing to improve our odds, at least, as we're getting to the more substantive stuff.
Yeah. Well, yeah, our safety countermeasure toolbox is an evolving toolbox, so we'll definitely take that and work with our lead engineer, Dan Mitchell, to see if that's what, an interim step that we can do.
With that introduction, I'll just take a moment to address that question. So updating signal timing, including the yellow times and all reds to the latest standard, is part of what we do every day. So our goal is to update 400 intersections a year, and we met that goal halfway through the year at this time. So we are updating all of those timings through the priority corridors and throughout the city on an ongoing basis. So we are addressing the concern that you raised.
Right. I mean, you can visually see when it's been done, and just eyeballing it, I don't see that many that are noticeably done.
Well, the amount of all red time, the time where the signals are red in all direction, depends upon the width of the intersection and the speed limits. So it may be different in different directions and for different movements. In addition to updating the yellow and all red time, we're also updating the pedestrian timing to provide for additional time to cross the street as prescribed by the latest standards. We're updating all of those things throughout the city.
And so we are actively doing that with pedestrians now.
We are actively doing that.
That's another problem we've run into on occasion that has caused us accidents, pedestrian accidents in my district certainly. With a lot of senior citizens, we've found the timing isn't always quite adequate for them. So I'm glad to hear that as well.
It is also worth noting that Tim mentioned that we're currently looking at locations where we removed red light cameras and doing a bit of a deeper dive, because a couple of years ago there was a national report that came out that analyzed red light camera programs nationwide and found that cities that did take them out saw a dramatic increase in red light running and crashes that resulted from red light running. So again, the red light cameras aren't the only tool, but we know that we still have a problem. And it's worth investigating a little bit more what the additional tools are, like signal timing, that can address that issue.
Right. I know we had one city where someone came and testified from that city that they removed their red light cameras, but made the timing changes and found that in 90% of the cases they weren't really necessary any longer because the timing handled the problem. Yeah. And so I know at the time we did this, we had sort of a little bit of a pissing match between council and DOT. And when we were asked for a report on what signal timings were necessary to make up for the loss of red light cameras, we were told at the time all of the timings were perfect as they were, which honestly I didn't think had any credibility whatsoever. So I'm hoping that we actually have looked at all of those particular intersections and given it a real analysis and now have timing that is accurate for that purpose.
Thank you, Councilmember. Yes, we have done that, and we're, as part of this evaluation, will consider what has changed since the time that those were removed. I just wanted to clarify the issue about the timing. It's really about the yellow times. The yellow times are set based on the approach speed or the speed limit, and it was short yellow times in San Diego that raised the alarm about red light cameras because those times weren't long enough. Vehicles were entering at the beginning of the red and getting caught by the camera. Our yellow times have been lengthened, and we continue to update those to the new standard as we move through the city. So that is a separate issue from the all red, which allows time for vehicles to clear the intersection before a green is given.
Yeah, and I've actually, just eyeballing it, noticed more yellow times that have been corrected, and I think that's very effective. I haven't noticed as many red timings.
We definitely we have a problem with red light running in Los Angeles, and that's what we continue to investigate to address.
Okay. Anything else?
No, that's it.
All right. I have another question, and it's potentially a can of worms. This presentation was great. I like the way you outline things. I like the way you explain things. I like the criteria by which you indicate you determine potential locations for priorities. The page 11, which lists the potential location priorities, talks about crash severity, dangerous behavior, social equity, geographic equality, party vulnerability, low cost, low complexity. I think those are the right criteria. Are those criteria responsive to the motion? If the motion as written passes, are you still able to use those 6 criteria? That to me is the crux of the question.
If the motion passes, we will certainly come back and do an annual update as the motion calls for every December, I believe. And between now and December, we will continue implementing safety improvements on the priority corridors that were scored with that methodology. Yes. Does that answer your question?
Not entirely.
Okay.
The motion says instruct DOT to begin reporting December of each year with a set of proposed Vision Zero hazard mitigation projects for consideration that seeks to achieve the following objectives. And it outlines 4 objectives. Crash severity clearly falls within it. Dangerous behavior clearly falls within it. You can argue low cost, low complexity falls within it because it's basically saying, most impact bang for your buck. In these criteria, I'm just wondering, do you have room for what I think is the appropriate evaluation of social equity and party vulnerability? And then some others on the council who would want to see the geographic equality considered as well. Does that still give you the latitude to do this kind of analysis. Because if, my main concern is on the social equity and the party vulnerability thing. If you've got 700 and something miles to do and you're trying to determine which ones to do, and you've got 100 miles and they're all equally hazardous and we know people who are going to die, there's certainly an argument to be made that if you can only do 25 miles of those, we should look to the parts of the city that have experienced historic disinvestment. And we know very clearly from the overlapping maps that that's the case. Does the motion, if approved, still give you the ability to do that, is what I'm wondering.
Yes, we believe that if the motion is approved, we still have that latitude to make those improvements.
Salita Reynolds, General Manager, just to sort of underline it even further, I would just take a step back. Vision Zero is a very young program in this country, let alone in Los Angeles, right? It just showed up in New York in 2014. We've just started it here. So what you heard was our best work to get to a transparent, data-driven, thoughtful, defensible work program. Because we have, 7,500 miles, we have to get to a work program that we can start with. Where do we begin? Because this is a goal that takes us through 2025, right? The goal is to get through the entire high injury network by that time, but we have to start somewhere. So our sort of approach is always that we are open to dialogue and debate, discussion and direction from policymakers about the approach that we've taken. It is a living program. It is meant to be open for discussion. I think one of the things that I've heard from various council offices is a desire to have liability in particular be infused into how we consider where we're going to be going and focusing our time and energy. That is something we're very open to. I believe that the criteria that we use, which is about, equity, vulnerability, and where's the worst of the worst, those things all fall under sort of can all be part of a larger framework for prioritization. And if there are other things that the council would like us to include there, we can. But we feel like we arrived at those criteria through a sort of a comprehensive open process, and one that follows the lead of cities like San Francisco and New York, who have achieved historic lows in their deaths over the last couple of years, when everybody else in the country has experienced increases. Now, we know we're not San Francisco, we know we're not New York, but if it can work in those two cities and their methodology works, then that's the best playbook we have. And we ought to start there and be evaluating and iterating and evaluating and iterating. So as far as, from my perspective, I think we still have, this gives us an open forum for discussion. If you want to direct us to use things differently or to modify things, we're open to doing that. But I think that the core there should stay a constant, and then we can add things on top of it if we need to. And just to be clear, we didn't use all 6 of those criteria.
That's correct. Yeah.
We used 3 of them. We didn't use geographic equity. We didn't use cost effective. We didn't use dangerous behavior. We only used worst first, right? Where do we have the highest raw numbers? Because Vision Zero is a raw numbers goal. We want to get to 0. 2, large numbers of children and older adults involved. And 3, social equity. So those were the things we used.
I understand that.
Got it.
I agree with everything you said, and I agree with everything you've done. What I'm trying to figure out is whether you would still be allowed to do that under these criteria. This criteria says greatest reduction of injuries and fatalities, data validation, roadway improvements, balancing reducing harm with significant liability concerns. Yeah. And it says these are the objectives. If those are the objectives, I want to figure out how you can still use social equity as a criteria?
So I think in terms of dangerous behavior, you can say that applies to the entire high injury network, right? Just by the creation of a high injury network, we have filtered where dangerous behavior is creating the most intense outcomes. So I would argue we have captured that just in the way that we've identified our first area of prioritization, which is saying not 7,500, but 460, right? And then every single one of those corridors has dangerous behaviors occurring on them, right? You cannot say that there's some, we think that speeding is the main sort of behavior that predicts the sort of severity of the outcome. And speed is a factor across the entire high injury network, right? There's, it's difficult to sort of parse that as a criteria for further prioritization. So I would argue that we have sort of captured that. And across all of the collisions and corridors we look at, that we're trying to understand what dangerous behavior contributed so that we can identify a solution. I would say that cost effectiveness is about a solution, not about a criteria necessarily. It's about the kind of tool that we apply to address the problem. So again, I would argue that we're incorporating that in our work program and in how we're coming up with our work program. The legal piece is a piece that I think we are still having conversations with the city attorney's office to try and sort of figure out how to incorporate that, what data set of theirs to use in terms of payouts, and then also to understand the full, robust meaning of the term liability. It's not just about payouts. It's about our exposure to liability as a whole. But I think to your question, if there is clarity that this committee or that the council wants to provide in terms of the utility of those other criteria, that would be helpful, because what this exchange is demonstrating is that, you know, it's in the eye of the beholder.
Yeah. Is there any urgency to moving this forward, or is it okay for me to keep this in committee a little bit so I can have more of an opportunity to work with the authors of the motion and fully understand? Because I think you're doing everything they ask, and I don't think the other stuff is inconsistent with it. I just want to make sure this doesn't inadvertently make it impossible to use those considerations.
Understood. Yeah. So our next report out would be December of this year to create, we've already issued the Vision Zero Year 2 action plan, so we've sort of already laid out
in 2 weeks
what we're planning to do for this year.
Yeah.
So I think between now and December, you know, further discussion and dialogue and conversation is completely appropriate, and we would welcome it, because again, we're very open, and we do want this to be something around which there is first understanding and second consensus.
Yeah, I don't want to keep this here long, but I think it benefits from a little more discussion. Sorry, didn't give staff a heads up on that one.
So you want to keep it in committee?
I think so, for at least a couple more weeks. Any objections to that?
I don't, but I do have one quick question though.
Yeah.
I'm curious to know, so as we move through the process of implementation, I would expect that the data will begin to show accidents in other areas that we haven't been targeting. So what are you going to do to address that as we move along, especially to the areas that we haven't targeted?
Yeah, so part of the Year 2 action plan talks about identifying new project areas based on new collision information that has been updated, and then we would go do the same thing we did previously, which is meet with each council office, go through the data, talk about the locations, and begin that.
So how often is the department going to revise the planned project corridors so that they can better reflect the greatest need? How often are you going to be doing that?
I mean, I anticipate that we do that on an annual basis as we get new year's worth of data available. So we did actually go through an exercise. High injury network is a living network. Hopefully there are corridors that come off. You know, we shrink it over time. That's the goal. But in the meantime, every year that we get a new bucket of data, we revisit the data set and we redo the network. Now, this year we did that, or the last time we did that, which was towards the end of last year, the network didn't really budge, didn't really change that much, which is, you know, can be discouraged. It's a little bit discouraging because it means that we haven't made progress yet. On the other hand, it validates the fact that there are stubborn trends in the same streets, in the same intersections, year over year over year, and we're focused in the right place.
We're also having to fight for resources for you. So let's
right.
not
Yeah.
forget about that.
Right. Yeah. So I'd hope that maybe we could have this for the next meeting, just see if I can work some stuff out, which is the same day we have the Vision Zero action plan, and try to do both in tandem. That would be. Okay. So we'll continue that potentially to the next meeting, but just listed as continued for now. And that, nothing else on the agenda, right?
Okay.
Okay, so we're adjourned. Thank you.